Why is diet advice conflicting after kidney surgery? Imagine trying to follow a set of instructions that keep changing. That's often how it feels for patients after kidney surgery. The reason for this confusion is that diet advice varies because each person's situation is unique and the science is still evolving. First, the type of kidney surgery matters a lot. If someone donates a kidney, they usually have one healthy kidney left. Doctors often recommend a balanced diet with moderate protein intake, around 0.8 grams per kilogram of body weight, to avoid overworking the remaining kidney. But if a person had surgery because of kidney cancer, their remaining kidney might be at risk of developing chronic kidney disease. In that case, doctors might suggest more restrictions on protein and sodium to protect kidney function. So, the same surgery can lead to different dietary advice depending on the individual's condition. Second, the stage of kidney function plays a role. When kidney function is still good, restrictions might be minimal. But if kidney function starts to decline, patients may need to limit potassium, phosphorus, fluids, and protein. These restrictions help prevent complications like electrolyte imbalances or further damage. Because each person's kidney health is different, recommendations can seem inconsistent when generalized. Third, different diets focus on different goals. The Mediterranean diet and the DASH diet are often recommended after kidney transplants because they promote heart health and blood pressure control through plant-based foods and low salt. However, these diets don't always emphasize protein restriction or manage potassium and phosphorus levels, which are important after certain kidney surgeries. This can make the advice seem conflicting when compared to more restrictive diets aimed specifically at protecting kidney function. Fourth, the science itself is still developing. While some studies suggest that eating less protein and salt can help reduce the risk of further kidney damage, there aren't always large, controlled trials to back up every recommendation. Many guidelines are based on observational studies or adapted from general chronic kidney disease management. This means doctors often have to use their judgment, leading to some differences in advice. Finally, individual factors like age, other health conditions such as diabetes or high blood pressure, lifestyle, and personal preferences influence dietary plans. Healthcare providers tailor advice to each person's needs, which can differ from standard guidelines or what other patients are told. That's why the advice can sometimes seem inconsistent. In summary, conflicting diet advice after kidney surgery happens because different surgeries and health conditions requiring different nutritional approaches. The stage of kidney function determines what restrictions are necessary. Various diets focus on different health goals. The scientific evidence is still growing, and personalized care is essential. Patients should always follow the guidance of their healthcare team, including nephrologists and dietitians, who consider their unique health status and the latest research. This personalized approach helps support kidney health, aids recovery, and reduces confusion from conflicting advice.